Good afternoon, guys. Is testosterone replacement therapy in your best interests? That's the question that I have to ask myself and discuss with you. The quantitative markers are important, obviously. They help formulate a diagnosis. However, there is more to the human body than numbers. There are complexities that you need to take into consideration, much like when we spoke about depression. Address the cause in order to prevent the sequelae or the complications. That way you can affect sustainable change. So let's consider this guy. He was late 50s and he had borderline melandrin levels. Now, according to the BSSM guidelines, you could make a case for trialing him on testosterone replacement therapy to see if it reversed his negative symptoms. So he presented with the usual symptoms, but his predominant symptom was fatigue, and it was afternoon fatigue, and that led to a cognitive decline, and that's what he was really bothered about. So, what other symptoms did he have? Libido was flagging, lack of morning erections. So it's all leading quite nicely into suggesting a trial of TRT. Tick, 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 tick. But on further questioning, it seemed that he had a problem with his sleep. He's a bad snorer. His wife used to give him the elbow. So the diagnosis of obstructive sleep apnea was on the table. Now, what's the deal with OSA? Well, essentially, obstruction, so you're narrowing of your airways, it causes a decrease in your oxygen saturation, which then stimulates the sympathetic nervous system to wake you up. So often guys either wake up fully alert or they wake up thinking that they need a pee. So commonly people think they have a problem with the prostate, but actually it's obstructive sleep apnea. Now, I use a CPAP mask and I can't sleep without it now. It's amazing. It's not very sexy, but I mean, it means I get a good night's sleep and I wake up refreshed. So I used to toss and turn, and now I pretty much wake up where I went to sleep. So you can't overemphasize, I always get those two confused. Overemphasize the importance of a good night's sleep. Now, my numbers are perfect. Perfect for me. Caveat. So, if I get a bad night's sleep, I still feel tired in the morning. So, testosterone does not cure life. So if you get a bad night's sleep, if you don't eat properly, you will feel rubbish. So testosterone is not a cure for life. Some people tell you it is. They just tell you that you should just keep upping your dose. If your issue is as a result of low testosterone, yes, of course, up the dose. But if you have normal levels, I'll say normal again, we've discussed this in the last video, so not to do it again, then surely you should be looking to other avenues. So libido, it's multifactorial. Just increase the dose. It's tiring, isn't it? So sleep is incredibly important. And so we've sent this guy off to have sleep studies. What else? He was a bit of a chunky monkey, and he was a little bit prone to desserts and cake. and his diet was quite carbohydrate dominant. So he's also chatting to Hannah, our nutritional advisor, who will be supporting him in actually finally adopting a healthy diet. Not only to make him feel good now, but also because he has a propensity to aromatization. So as we know, the aromatase enzyme is within the adipose tissue of the skin. So if you can reduce that propensity by losing weight. And when I say losing weight, I mean weight management. So getting to a healthy weight. So those are the two areas that this guy needs to address before considering TRT. I could have quite easily put him onto testosterone replacement therapy. There was justification, but was it in his best interests? And you could argue, yes, because I could get him cracking numbers. But he could also get reasonable, healthy, optimal, normal, perfect numbers, potentially, from making some adjustments in his lifestyle, namely sleep and diet, which are huge. These are huge elements of health. So if these haven't been adequately addressed and you go, I want to jump on TRT, then you're really going to struggle, because TRT is involved. Not only is it involved from the fact that you're going to have to pin daily, you're going to have regular blood tests, you're going to have your protocol tinkered with to find that optimal testosterone to estrogen ratio. It's money. So this guy could have thousands out of him, but it's not in his best interests. So I've got no interest in ripping him off, because I could have quite easily done it, but it's called ethics. Your numbers were low enough for me to give you testosterone, but was it in your best interests? The answer is no. So we've told him to go and address his sleep and diet, and we will review him again in the future, because that answer may change with time. TRT may be in his best interests, but even on testosterone replacement therapy, he'd still have to address his diet, he'd still have to address his sleep in order to feel good. So rather than looking for a solution, if you address the foundations, you can sometimes prevent. So we always talk about the importance of prevention over cure. So, TRT cures life. Give me strength. Just keep up in the dose. Give me strength. So this guy having bad sleep, he was predominantly catabolic all the time. And if we realise the importance of balance, then you realise that he must have a decent night's sleep in order to have a decent testosterone. So he was cortisol dominant. So he'd worked in the city for many years, packed it up, then realised he was wanting to achieve more, so he took on another role, sort of again high functioning, high cognitive functioning. But there was something missing, and that was exercise. So if you look at our skeletal structure, tall, slender skeletons, we are designed for endurance. We're designed to be active. We hunt and gather. No, we don't. We just go to the fridge now, don't we? So you should be physically active in order to not only use your testosterone, but also to build your testosterone. Catabolic, anabolic, day, night. Catabolic processes predominate in the daytime, cortisol. Anabolic processes predominate in the nighttime. Rest, recover, grow. So you recover from the day and you prepare for the next day. Hormones It's a 24-hour cycle, which is why we advocate daily injections, because you can achieve relative stability if you have a normal high SHBG with less frequent injections. But for true stability, and recognizing the fact that irrespective of daily injections, you are having a peak and trough, we're actually deliberately causing a peak by injecting every day. And guess what happens? You have diurnal variation in the body. So we always talk about attempting to mimic natural physiology. It's as close as damn it with daily injections. So we've had dramatic success from switching guys who, in theory, because of their SHBGs, do not need to inject daily. However, their numbers and their qualitative symptoms have improved. So it fits. Daily injections. Trying to work with your physiology. Understanding the importance of balance. Well, shall I? No, I won't say it. Okay. Yeah. Namaste.